Here's a medical thing they don't tell you. Dumping syndrome is absolutely brutal. Let me tell you how it happens in my world as an oncologist. So usually someone has stomach cancer from a variety of risk factors. They're either heavy smokers, they didn't have enough fiber in their diet, meaning they barely eat fruits or vegetables. Sometimes it's also due to the H. pylori infection, which is more common in people that are born outside of the United States. Now, depending on the stage of the cancer, you may first want to do something called neoadjuvant treatment, which is where you give chemotherapy or immunotherapy to hopefully shrink the amount of cancer that's in the stomach so that when the surgeon goes in there, there's less to cut out. That's with the hope of preserving the most stomach tissue as possible because you still want a large amount of your stomach to remain intact so that it could fulfill its function. Now, let's say you got a lot of your stomach taken out because the cancer was either too large or the chemoimmunotherapy didn't make a difference in the beginning to make it smaller. Then the surgeon has to go in there and take out a rather large part of your stomach, and that's where dumping syndrome starts. Your stomach's job is to regulate the way the food moves from the stomach to the rest of your intestines, as well as it absorbs the nutrients from that food. So then let's say you eat some food and that food doesn't get absorbed the way that it should because half of your stomach is missing. Then it goes to your intestines, which sure, they do absorb some of the nutrients, but they don't do it the same way the stomach does. So it leads to a lot of abdominal pain, nausea, vomiting. Even hypoglycemia can happen because again, the way that sugar is absorbed is different in the stomach versus the intestines. Hypoglycemia is no joke. It can send you to the hospital and very bad things can follow that.